Hello and welcome to Aging Well. I'm your host, Nathan Lamb, and with me today we have a huge amount of expertise in the studio. We have community social worker Lisa Waxman from Somerville-Cambridge Elder Services. Welcome.
Thank you. It's great to be here.
Oh, excellent. And we are welcoming back Protective Services social worker Norah Al-Wetaid. Norah, welcome.
Thanks. Happy to be here.
Oh, excellent. So it's going to be a great show today. Basically, we invited you in to talk about self-neglect. And basically the idea here is that with the holidays coming up, it's a time of year where people get together and they see each other again. Maybe they haven't seen each other for a few months. And sometimes when that happens, when families are visiting, they notice changes in the behavior or living conditions of people in their family. And the purpose of the discussion today was to sort of talk about, sort of walk people through some of the things to look for and some of the ways to handle that challenge. So I'm thrilled you guys are here. I guess maybe a good place to start, the way that I've heard this defined from a protective services standpoint is self-neglect. So I was sort of curious if you could help explain what self-neglect is.
Absolutely. In its most basic definition, it would be that it's a failure to meet your most basic needs. So those are like food, clothing, shelter, medical care, sometimes personal care. The big ones that we see are shelter and medical care, sometimes food.
So it can vary in severity, and there's definitely a lot of different types of
Absolutely,
self-neglect. And in terms of the different types, can you give some examples on the ones that you would run across?
Yeah. With providing shelter or not providing adequate shelter, we often see in protective services a lot of evictions, occasionally unsafe structures, unsanitary conditions in the home. With not meeting basic needs with medical care, it's oftentimes not attending medical appointments, not attending to their medical needs, picking up prescriptions or taking them as prescribed. We see a fair amount of elders that maybe their memory is declining and they can no longer manage their medications. They can get super complex, and 50 pills a day is really, or exaggeration, but 20 pills a day can be quite a bit to manage. On food, we see a fair amount of also. It can be something simple like not managing eating the right food for your medical conditions, but also we see elders that maybe are mismanaging their finances. Sometimes it's on alcohol or drugs, or other times it's spending it on children. But if they run out of money, they can't buy food anymore. That's a big one that we actually see.
Absolutely. And sometimes inadequate personal care can be another form of this neglect.
Yeah, exactly. That's the one that people probably notice the most. It's the most obvious form of it as a outsider looking in. It's sometimes losing the ability to care for oneself, which can be kind of hard.
Absolutely. And it seems like in things that involve safety as well, like if you leave the stove on, things of that nature.
Yeah, it doesn't necessarily fall under the other categories, so yeah.
Is this something where it can present a challenge of knowing how to approach that situation when you detect it?
With a loved one? Absolutely, yeah. Yeah, it's really hard to have a discussion with somebody about the fact that they're losing their faculties or ability to care for themselves. It's kind of natural that as we age, we lose some of our abilities, and it can be extremely hard to ask for help or to even recognize when the decline's happening. Sometimes it's really slow, and all of a sudden you're no longer able to do the things you could do before.
Absolutely. So what is a good way to proceed when people notice these signs that there could be some form of self-neglect? I can open it up to...
Yeah. You know, what we find the best way to proceed is to be very respectful and to really approach the situation from the person's point of view, and to work with an older adult very slowly and have them acknowledge what they feel the issue is, and work alongside with them in addressing the problem. I think it's very important to state that all adults at some point in their lives of any age self-neglect. We all do when we don't go to the doctor when we're not feeling well, or if we don't eat well when we have diabetes. We all, to a certain degree, self-neglect. But unfortunately, as we get older, the stakes are higher. The consequences could be more dire. So what we try to do is we try to validate with older adults that change is really hard. And for many older adults, change means loss of something. They may fear that it's going to be a loss of independence or loss of the way that they routinely live their lives. So acknowledging that, validating that, and being on the older adult side is the way to get in the door to develop the rapport with them.
Absolutely. A lot of good points in there, especially about how it's something that we all do at some point. So it sounds like listening, understanding, probably some degree of patience is involved here too, because it's probably not something that people are always eager to acknowledge, that you might need help when you didn't in the past. So
Yeah, accepting help requires change. And for most adults, even younger adults, change doesn't happen overnight. So it does. It really requires feeling understood and trusting that accepting help will benefit you.
Absolutely. And I was just going to ask, when people can actually report self-neglect to Adult Protective Services
They can.
at Somerville-Cambridge Elder Services, in which case they might end up speaking with you.
Yep.
So I was just curious, can you tell us a little bit about what happens when somebody reports self-neglect?
Absolutely, yeah. If you have concerns about an elder in your life, you can call us. That's our job, is to investigate and try to figure out what's going on. If it meets our criteria, so it has to be pretty significant risk, Protective Services social worker would go out, and we do call ourselves social workers, not protective service workers that are coming in to impose our will. We go out and meet with the elder and try to talk with them, let them know what the concerns are, and try to figure out what the root of the problem is. With self-neglect, it can be hard because it's us pretty much saying you're not able to meet your needs anymore. That's the implication, at least, and that's what people hear. And our message often is to let them know that we want to do what we can to keep them home for as long as possible. We'll respect their rights as much as possible. So our primary concern is to respect people's rights, and we want to do harm reduction. So we won't come in and shove services on people. We try to do whatever we can to make it as safe as possible.
I have noticed that in speaking with you before, that the not imposing of the will, respecting the wishes of the person involved is very important to you. In a lot of cases, if I remember correctly, you actually need the consent of the person being helped for them to receive help for protective services, which I think people don't think of that when they hear the name protective services. They sort of think of this very prescriptive, coming in and we're going to say what's what. The process you've always described whenever I've spoken with you sounds very different. What are some of the ways, granting that somebody wants help through the program, what are some of the ways that people might be able, are there programs that can help people meet these needs in their homes that you're able to connect them with?
Absolutely, yeah. It would depend on what the problem is. If it's eviction, that's something that we can work directly with an elder on. We have access to legal resources, so that's one of the big ones. If they just need help around the house, we can help make a referral to home care. Sometimes people need more ongoing supports, and Protective Services is very short term. Our goal is to resolve the problem quickly and then try to connect it with long-term services for much longer. So a lot of times it's referring to home care, sometimes it's referring to our Connect program. If people have assets, we can refer to other programs or geriatric care managers, one of those types of programs.
Absolutely. So it's definitely, in a lot of cases, you're connecting people with other programs that we offer for people, which is great. I think that's it for segment one. We'll take a brief break and be back in a minute. Hello and welcome back to Aging Well. I'm your host, Nathan Lamb. With me today is community social worker Lisa Waxman. Welcome to the show.
Thank you. Great to be here.
Yeah, absolutely. And also here today, we're welcoming back Protective Service social worker Norah Al-Wetaid. Norah, welcome back.
Thanks. Happy to be here again.
Oh, excellent. So today we're talking a bit about self-neglect, about how Somerville-Cambridge Elder Services can help. And it is an area that's sort of ties into our central mission as an agency, because for those who aren't aware, we run into people all the time who aren't familiar with what we do. A huge part of what our mission is helping people live in the setting of their choice, give their options for staying at home as long as they like, supporting independence in their decision making. And I think a lot of what we do to help address self-neglect sort of follows that same philosophy.
Mm-hmm.
So I think it's a great topic because it's very pertinent to what we do, and hopefully we'll be able to discuss a couple of programs specifically to educate our viewers on that a little bit. And Lisa, there was one program in particular I was curious to learn a little bit more about today. It was the Connect program.
Mm-hmm. The Connect program is a great program. It's grant funded by our agency, and it was a way to kind of close the gap between what happens when a client either gets screened out of protective services or comes out of protective services because their risk has been lowered. So what we do in Connect is we meet the clients where they are, and we help, as the name implies, connect them to resources. So it's a way of connecting them to mental health resources, helping them connect to other services in the community. Sometimes we'll see a client maybe who's recently retired and doesn't really have, is unsure of what they're going to do, and doesn't have much of a social life because they've been working. So we'll help connect them to social resources and to support them wherever they are. So it's a great program.
I remember we had a piece on it in an industry publication a while back, and our director of clinical, I think she was talking about how it's this sort of fusion between, there's a mental health component,
Mm-hmm.
there's also a social work component.
Yes.
And the two of them kind of work together to
Mm-hmm.
address the whole person's
Mm-hmm.
needs.
Exactly. In traditional mental health treatment, a client goes to a clinic, they see a psychotherapist for a 50-minute hour, and they receive the therapy they need. A lot of our clients come to us, to our program, because they're feeling depressed or they're anxious. They may not have a diagnosed mental health condition, and we don't really need to diagnose them to work with them. We can just kind of help them work on the symptoms they may be experiencing and help them access the resources that are going to make them feel better. We also help them with a little bit of case management and some medical advocacy if that's what they need, and connect with outside providers, as well as working with other departments within the agency.
I'm thinking of specific examples. If I remember correctly, the article listed instances of people who had issues with hoarding,
Yes.
where we connected people with resources for that.
Mm-hmm.
Are there any other examples of common issues that you're able to help people with through Connect, like the challenges? I think maybe evictions might have
Yes.
been another one.
Yes, we do help people who are having problems with their housing, especially around hoarding, and helping people accept maybe if they need heavy chore services or just assistance to keep their housing in good shape. They may not be at the level where they would be in protective services, where they are in the eviction process, but we want to help them if they're at risk of eviction. So it's important to take the time to spend with these folks and to build the rapport and the trust, but yet to meet them where they are and to understand that they may be living in very small quarters and they have not a lot of space to keep their belongings. So we try to work with them on making sure that they're going to maintain their housing before they hit the eviction point.
Absolutely. Is there anything else you'd want to add about Connect?
So it's a great program. One of our, but it is a grant-funded program, so resources are a little bit limited. We do have another program in our agency. It's called Community Living Options, and this is a privately funded program. It's private pay, and this is an enhanced and very individualized type of care management program where we can work with people long-term and help them access the care and resources that we need. Again, depending on what the client wants and what the client needs, we can meet more regularly with them and longer term, maybe help them supervise or oversee their care providers, take them to go with them to doctor's appointments, provide that higher level of medical advocacy that they need. A lot of times we work in conjunction with other family members or directly with the elder themselves to help them manage the complex issues and needs in their life.
So there's a variety of scenarios where that could come into play, but a common one would be they need some of the home care services, but they don't meet the eligibility requirements. That could be an option for them if they have the assets to go that route.
If they if they have the resources to do that, absolutely.
And there also seemed to be a slightly higher level care management aspect, which is a little different, I think, than home care. Can you tell me a little bit about that?
Certainly. So sometimes people will see people in our community living options program. They may not have anybody around, a family member, so they just need that. They need that extra person to come by more regularly and be in touch with their care providers. Like I said, supervise them, make changes as needed, accompany them to different appointments, and get involved in their medical care in a more in-depth way than we can in any of our other programs. So that's very important. And then some of our folks in the Community Living Options program decide that living in their current environment doesn't necessarily work for them. So they may want to pursue other options, not necessarily move, but just want to take the time to pursue other options, which we can do with them. We can research other living options for them, go with them on those visits, and help them make a clear decision, help them themselves make their clear decision about what they would like to do, about their care and about their living situation.
So it could be from if you need a little extra help to much larger endeavors, it sounds like.
Yeah.
Anything else you'd like to add on that topic before we move on?
No, that's
I guess the only other thing I was curious about is it seems like there's a lot of complicated issues where there's a lot of moving parts in play. Maybe more going on than initially seems to be the case. How do you go about working through that process to sort of address the underlying needs? Can you tell me a little bit in general, how do you uncover the sort of underlying processes while engaging with the people who are requesting help?
Yeah.
I think in protective services, we're kind of strangers showing up unannounced oftentimes at someone's doorstep. And I've noticed that the best way to, at least for professionals to engage, is to, well, anybody actually, to be respectful first and foremost, and make it clear that you're there to help and not do things against their wishes. I try to stress repeatedly that they have the right to self-determination, they have the right to make choices for themselves, and we want to respect that as much as possible. And the more you reinforce that as a family member or anybody, it's going to make an elder more inclined to disclose things to you or open up. And you might not get to it the first time, even as a family member, especially as a family member. I think sometimes elders don't want to disclose that something's going on to a loved one because it's kind of shameful or can feel like that. I think all of us try to understand that asking for help is extremely hard. Even for any of us, it's hard to ask for help. Moving slowly is one thing. In protective services, we do anything we can to do harm reduction. That's what our focus is. So if you want nothing else at all, what can we do right now to make you safe? And I think that's an approach family members can take also. You can't just all of a sudden throw in a bunch of services. You need to be slow about it. And the more respectful you are, I think the more an elder will open up about what's going on.
Yeah, and sometimes it's necessary for us to speak with family because families can tend to rush to judgment because they want the problem fixed now. And then, what one person may think is, what a family member might think is a major issue, the elder may not see as much as the family member. So sometimes it's really important for us to get involved in the family conversation to help negotiate that, reducing harm while also respecting the elder's right to self-determination, starting where they are. Like I said, every adult of every age tends to self-neglect. But it's just important to keep the conversation going and be respectful and not push too hard because it can backfire. And the elder wants you to be an ally. the older adult needs an ally and somebody who understands them, and that, we're trained to be understanding and respectful and to validate.
Absolutely. And one more topic before we wrap this segment up. What are the limits to what we can do to help? Because I know we do the best that we can
Yes.
with what we have, but what are some of the common limits that we run up against in trying to help with these situations?
Right. Well, exactly. There are limits. Our programs are voluntary for our older adults. They can join our programs and they can also leave our programs. So while we may not agree if they're going to leave a program or refuse a service, it's ultimately their choice. A very common thing that we do see happen is older adults will start our home delivered meals program within our agency because if they're food insecure or maybe shopping and meal preparation is very difficult for them. Or they may have some weight loss issues. So we're happy to put in our home delivered meals program. But sometimes we see elders decide to leave the program because they don't like the food or a multitude of other reasons they might stop. It's not our position to impose our will and say, no, you have to have these meals. We like to encourage them to pursue other options and to think about the choices that they're making and offer some suggestions, but it's not our place to impose our will. We're working with adults, and they're over 18, and as long as they're deemed competent by their physicians, which most people are for the most of their lives, we need to respect that because that's how we want to be treated.
Norah?
Yes, I'm going to reiterate what you have said, but with protective services specifically, I think people call when they're really concerned. Things have reached a tipping point and they want help, and they call protective services wanting us to do something. We don't do things against people's wishes, barring exceptions where somebody does lack capacity or is incredibly unsafe and maybe not cognitively able to make decisions for themselves. So we're not child protective services. We have to listen to what the elder wants, and it can be frustrating for loved ones that we do have those limitations. And our focus, the agency's focus, protective services, social workers, all of us, we just want elders to be safe, but also make decisions for themselves as much as possible.
Absolutely. With that, I'm going to wrap up this segment. Thanks again. And we'll be right back with our final segment. And welcome back for our final segment of Aging Well this month. With me today in the studio is community social worker Lisa Waxman. Welcome to the show.
Thank you. It's great to be here.
Glad to have you. And protective service social worker Norah Al-Wetaid. Welcome back.
Thank you. So happy to be back again.
Yeah, you guys have been great today. This has been a fun show. We're going to have to do this again sometime soon. So our final segment, we're going to take a closer look at self-neglect. And I heard that you might be interested in telling us a little bit about an example of self-neglect that you've come across in general, because we strictly observe people's privacy. But in a general sense, you could tell us a little bit about how these things go.
Sure. Well, what we see a lot in older adults is what's maybe turned into self-neglect. Maybe they've been living a certain way for a very long time, but as they age and maybe their mobility is decreased, eyesight has decreased, and maybe there's a little bit more frailty, a common situation might turn into self-neglect. For example, we see all the time in homes, we see throw rugs and scatter rugs. And for the most part, they're okay, but if you are a fall risk or if you're a little uneasy on your feet, a scatter rug or a throw rug could be a big problem. So how it's self-neglect is if, when it's addressed with an older adult that this could be a problem, people are usually unwilling at first to change any of their decor, or they don't really want to get rid of a rug that may be serving a purpose, whether it be decorative or any other personal use purpose. We also see self-neglect in some of the buildings around Somerville and Cambridge that have gone non-smoking. And it's really hard if you've been smoking for many, many years to just stop. So some folks do continue to smoke in their apartments or in unauthorized areas of the building. And unfortunately, that puts them in at risk for having some legal issues with housing. So that is a form of self-neglect as well. Also, we see it quite often when people aren't feeling well and they're reluctant to go to the doctor, or if they're reluctant to follow medical treatments. Maybe they don't finish a full course of antibiotics, or they don't feel that they need a certain medication that was prescribed. We see that quite a bit. Sometimes people will have a stack of bills that they feel overwhelmed to pay for various reasons, and decide that they don't want to pay a certain bill, or that a certain company can wait, and that can put them at risk of maybe having trouble with their utilities, or perhaps difficulty with their mortgages or their rents. These may sound like very subtle things that everybody, a lot of adults tend to do, but we worry as people get older, these subtle examples of self-neglect can be pretty consequential.
Absolutely. Are there some creative ways you've been able to help with some of these challenges?
Yes, the good thing is one of the main reasons people call for help in many of our programs is because they want help either cleaning their homes or they want help paying bills, which is wonderful. They are opening the door for that kind of help. It's that executive functioning type of help that people usually ask for up front versus the personal care kind of help, which is harder to accept. So sometimes people, they want assistance with organizing things in their home, paying bills, structuring their routine, setting appointments. People are much more open to accepting that kind of help. And once we develop that kind of relationship with a person, we feel that we can maybe open the door to offering some suggestions for other areas of help that a person might need.
Absolutely. And we're running short on time, so I just have one last question. The collaboration, both between different programs at SECS and external, and SECS is Somerville-Cambridge Elder Services, and external agencies. Can you tell me a little bit about how that works? My understanding is it's a fairly collaborative environment.
Yes, I always say working in Somerville and Cambridge is a great place to be a social worker. I've worked in 3 other states, and the resources we have in these 2 communities are wonderful, as well as the collaborative professional relationships are great. We work with 2 great hospital systems. We have councils on aging in both Somerville and in the Cambridge area. We have long-standing relationships with the professionals there. And other.
I think in protective services, we collaborate a lot with medical providers, so the 2 big medical providers, 2 big hospitals. And we also collaborate a lot internally within the agency. With the Connect program, we make so many referrals. We rely on that program, and it's been an incredible asset to the elders that protective services works with, because they can be involved long term.
That's absolutely true.
We also have really great collaborative relationships with the housing authorities and the housing managers, because a great number of our clients do live in elder housing. So they have resident services coordinators in a lot of the buildings, and it's just a great joy to be able to work with professionals who are there in the building.
Absolutely. I'm sure they have some great perspective they're able to share. And one thing before we go, Protective Services, I know that you can be contacted there during the week. You also have a 24-hour hotline.
Yep, during the week you can always call just the agency and ask for protective services. After hours, actually anytime, I think you can call this number. It's the 24-hour elder abuse hotline. It's 1-800-922-2275.
And during regular business hours, you can always call our Aging Information Center at 617-628-2601. My basic way of explaining it is if you have any questions about aging, just give them a call, and they're usually pretty good about finding what's out there for you.
Yes.
So they're great at that.
It's a no wrong door phone number, so please call.
That's really excellent.
Yes.
Norah, Lisa, I want to thank you again. You've been great guests. We're definitely going to have to do this again sometime. And that's all for this month for Aging Well. We'll see you next time. Thanks again. Bye-bye.